What happens when an arrogant Australian doctor follows his Filipino nurse colleague home to her remote province, expecting to find backward medical practices? This story from a small town in Iloilo will leave you speechless. Dr. James Mitchell thought he'd prove Filipinos were unprofessional. Instead, he discovered something that shattered his entire worldview. Stay until the shocking ending. Dr. James Mitchell was 35, head of emergency medicine at Sydney's prestigious Royal North Shore Hospital. He graduated top of his class from University of Sydney, published research internationally, earned six figures annually. His colleagues respected his medical brilliance, but avoided his company. James was insufferable. He dismissed nurses as order takers, mocked non-Western medicine, and believed Australian healthcare was the only standard worth following. Isabella Cruz was 29, a Filipino registered nurse who'd worked at Royal North Shore for 3 years. She held a master's in emergency nursing from University of Technology, Sydney, spoke 3 languages fluently, and maintained composure under James's constant condescension. While other nurses complained to HR about his behavior, Isabella simply worked harder, proving her competence through actions. She never argued back, which somehow irritated James even more. Their conflict exploded during a particularly chaotic emergency shift when James barked orders at Isabella, calling her intervention nurse overstepping. Isabella had correctly identified septic shock symptoms he'd missed initially. She saved the patient's life, but made him look incompetent. Furious and embarrassed, James filed a formal complaint about cultural differences affecting professional judgment. Isabella's response shocked everyone in the meeting. "If you believe Filipino nurses are incompetent, come see where I trained," Isabella said calmly during the HR meeting. "Visit my province. Observe our rural hospital. Judge our backward method yourself. If you still think we're unprofessional after that, I'll resign quietly without fighting your complaint." James, sensing easy victory and a chance to prove his superiority publicly, accepted immediately. He had no idea what he'd just agreed to. Quick favor, hit like, subscribe, and drop a love emoji below. What he discovers will shock you. Now, let's see what happened in the Philippines. 2 weeks later, James landed in Iloilo City with expensive luggage and patronizing expectations. Isabella met him at the airport in simple clothes, driving a modest sedan, no driver, no luxury. The 2-hour drive to her hometown of San Rafael showed James a Philippines he'd never seen on tourist brochures. Rural roads, simple houses, carabaos in rice fields. He documented everything with photos, already composing his scathing report mentally. Isabella's family welcomed James with overwhelming hospitality that made him uncomfortable. Her parents insisted he stay in their modest home despite his protests about hotels. Her father, a retired teacher, spoke eloquent English. Her mother, a midwife, prepared massive meals. Her younger siblings asked endless questions about Australia. James felt suspicious of such kindness. Nobody was this welcoming without wanting something, surely. The next morning, Isabella took James to San Rafael District Hospital, a small facility with 40 beds, limited equipment, and staff shortages. James's critical assessment began immediately. Outdated machinery, lack of specialized departments, nurses doing tasks that Australian doctors handled. He took notes, already feeling vindicated. Then he observed an emergency case that changed everything about his confident superiority. A farmer arrived unconscious from the fields, vitals crashing, symptoms suggesting severe pesticide poisoning, but no clear history. The hospital had no toxicology lab, no advanced monitoring equipment, minimal medications. James expected chaos and failure. Instead, he witnessed the most impressive emergency medicine he'd ever seen, just not in any form he recognized or valued initially. Isabella and the local staff moved with practiced precision despite limited resources. They improvised monitoring equipment, used clinical assessment skills James had forgotten from relying on technology. The head physician, Dr. Santos, trained at University of the Philippines but working rural for 20 years. Made rapid diagnoses through observation alone. Isabella anticipated needs before being asked, functioning as physician equal, not subordinate. The farmer stabilized within an hour. James stood useless in the corner, realizing his expensive equipment knowledge was worthless here. These medical professionals were doing more with less, improvising brilliantly, using clinical skills and teamwork he'd neglected. When Dr. Santos asked James's opinion on treatment, expecting collegial discussion, James had nothing valuable to contribute. His prestigious training suddenly felt hollow and overly dependent on technology. Over the following days, James observed case after case that shattered his assumptions. A nurse sutured complex wounds because the single surgeon was in another emergency. Her work was flawless. A midwife managed complicated breech delivery with just Isabella assisting. Both mother and baby survived beautifully. Staff worked 12-hour shifts without complaint, often staying longer because patients needed them. Nobody was watching the clock. What shocked James most was the relationships between medical staff and patients. Doctors knew families by name, remembered patient histories without computers, provided care regardless of ability to pay. Isabella spent her lunch breaks teaching mothers about infant nutrition, not because it was required, but because it mattered. Medical care here wasn't transactional. It was community responsibility, personal investment, genuine compassion. James accompanied Isabella on house calls to patients too poor or sick to reach the hospital. They traveled by motorcycle through muddy roads, carrying supplies in backpacks. One elderly woman with diabetes received free insulin that Isabella purchased with her own money. "How do you afford this?" James asked. "I don't spend money on designer things," Isabella replied simply. "This is where my salary should go." That comment hit James like a physical blow. He mentally calculated his own spending: luxury apartment, expensive car, designer watches, fine dining. He'd never once considered using his salary to help patients who couldn't afford care. Medicine for him had become about prestige and profit. For Isabella and her colleagues, it remained about actual healing and service. The contrast shamed him deeply. On the 5th day, a pediatric emergency tested everyone. A 7-year-old boy presented with severe dengue fever, hemorrhaging internally, needing immediate platelet transfusion. The hospital had no blood bank, no platelets available. James assumed the child would die. In Australia, they'd call specialists, use advanced equipment. Here, they called the community instead. What happened next left James speechless. Within 30 minutes, 20 villagers arrived at the hospital to donate blood. Farmers left their fields, teachers left classrooms, even the mayor came. Dr. Santos rapidly tested donors, extracted platelets manually using their limited centrifuge, and prepared the transfusion. The entire community mobilized to save one child. Isabella coordinated everything calmly, knowing exactly who to call, who had compatible blood types, who could donate safely. The boy survived. His family couldn't afford to pay anything. Dr. Santos charged nothing. The donors refused compensation. "He's one of ours," they said simply. James watched this collective action, this community as medical system, and something inside him fundamentally broke and rebuilt simultaneously. This was medicine as he'd never conceived it, cooperative, communal, driven by love rather than economics. That night, James couldn't sleep. He sat outside Isabella's family home, listening to nighttime sounds, crickets, distant roosters, neighbors talking. Isabella joined him, perhaps sensing his internal crisis. "You think we're backward," she said gently. "And technologically, maybe we are. But we remember something Australian medicine forgot. Patients are people first, members of community, not just cases or revenue sources. That's not backward." James finally spoke honestly for the first time. "I've been a complete arse, haven't I? Arrogant and ignorant." Isabella smiled slightly. "Yes. But you came here. That takes courage or foolishness, maybe both." They talk for hours about medicine, purpose, what healing truly means. James confessed his loneliness despite success, his empty relationships with colleagues, his sense that medicine had become mechanical. "You forgot the soul of it," Isabella said. The next morning, James asked to stay longer. He canceled his return flight, told the hospital he needed extended leave. Isabella arranged for him to work alongside the San Rafael staff, learning their methods. James, who'd never taken instruction from anyone he considered beneath him, became a student again. He learned to diagnose without technology, to improvise treatments, to see patients as community members. A week became 2, then 3. James learned Hiligaynon phrases, ate with his hands, traveled by jeepney, slept in simple accommodations. He assisted in surgeries with minimal equipment, delivered babies in homes without power, treated infections using local knowledge combined with medical science. His expensive clothes stayed in his luggage. His prestigious title meant nothing here. Just his hands, knowledge, and willingness to serve mattered. James began documenting everything differently, not as criticism, but as evidence of brilliant medical innovation under constraints. He photographed improvised equipment, filmed collaborative problem-solving, interviewed staff about their decision-making processes. "The world needs to see this," he told Dr. Santos. "Not as poverty porn, but as medical excellence under impossible conditions. You're doing world-class medicine that puts us to shame." During his 4th week, James witnessed Isabella's full story. Her parents had sold their small land to fund her nursing degree. Her siblings postponed their own education so she could study first. When she got the Australian job, her entire town celebrated. Their daughter would earn good money, send remittances, lift the family. Instead, she sent most of her salary home, but also funded the hospital's medication shortages. "You could live comfortably in Sydney," James said. "Designer clothes, nice apartment, savings. Why send everything back?" Isabella's answer was simple and devastating. "In Sydney, I'm one nurse among thousands. Here, my money saves lives, literally purchases insulin, antibiotics, emergency supplies. Where would you rather your salary matter?" James had no answer. His luxury spending suddenly felt obscene and meaningless. James's transformation became visible to everyone. He apologized to Dr. Santos for his initial arrogance. He thanked nurses for teaching him improvisation techniques. He played with children in the hospital ward, learning their names and stories. The staff, initially suspicious of the arrogant Australian, gradually accepted him. Isabella watched this change with quiet satisfaction. She'd gambled that exposure would cure his prejudice. She'd been right. On James's final evening, before returning to Australia, the town held a despedida, a farewell gathering. The community thanked him for his service, presented him with a simple woven mat, asked him to return. James, who'd arrived expecting to find incompetence, left having found the most competent medical professionals he'd ever worked with. He also found something else, a reason to rethink his entire career approach. Back in Sydney, James returned to Royal North Shore fundamentally changed. He immediately withdrew his complaint against Isabella, filing instead a formal apology and commendation for her excellence. His colleagues noticed the difference. James thanked nurses by name, collaborated instead of commanded, stayed late to help rather than watching the clock. He was becoming the doctor he should have been all along, learning humility from Filipino professionals. James used his research credentials to publish a paper about improvised emergency medicine in resource-limited settings, featuring San Rafael Hospital. He presented at international conferences, showing how Filipino medical professionals achieved excellent outcomes despite having a fraction of Western resources. His colleagues were skeptical until they saw the evidence. Then they were stunned. Isabella's hospital received recognition and funding from international medical organizations. 6 months after returning, James proposed something radical to Royal North Shore administration, a partnership exchange program with San Rafael Hospital. Australian doctors would train in improvisation and clinical skills. Filipino staff would access advanced technology training. The hospital board initially dismissed it. James persisted, using his reputation and research. Eventually, they approved a pilot program. Isabella became the program coordinator. The partnership transformed both institutions. Australian doctors returned humbled and skilled in clinical diagnosis. Filipino nurses received specialized certifications. But more importantly, the Sydney staff learned what San Rafael already knew. Medicine is fundamentally about human connection, community responsibility, and service over profit. Hospital culture shifted. Patient satisfaction improved. James watched his small redemption create ripples he'd never imagined. James and Isabella's professional relationship evolved into deep friendship. He visited San Rafael annually, each time staying longer, contributing more. He funded scholarships for rural Filipino medical students, established a medical supply donation system, and became an advocate for recognizing non-Western medical excellence. His arrogance transformed into advocacy. His prejudice became purpose. Isabella's gamble had not just changed him. It had created an ally. 5 years after that first visit, James made a permanent choice. He resigned from Royal North Shore, moved to the Philippines, and joined San Rafael Hospital staff full-time. His Sydney colleagues thought he'd lost his mind, abandoning prestige for a rural posting. But James had finally found what his success never provided, meaning community, the soul of medicine. He discovered what matters more than recognition or wealth. So what happened when an Australian doctor visited his Filipino nurse's province expecting to find incompetence? He discovered that true medical excellence isn't measured by equipment, but by skill, compassion, and commitment. He learned that Western medicine forgot its heart while perfecting its technology. Sometimes the greatest discoveries happen when we're humble enough to learn from those we dismissed. Thank you for watching until the end.